This presentation is part of a group assignment in Info 745, Special Libraries and Information Centers at Drexel University. Our group was tasked with developing a plan of action for a health sciences library at a major university. The new university administration has implemented a new initiative for community outreach. The librarians at the Health Sciences Library want to participate in the outreach efforts. One reason for doing so is to demonstrate the library's value to the university administration. The library has tried to engage in this type of outreach before. However, the results of the previous attempt were less than satisfactory. The poor results were largely due to a lack of understanding on the part of the librarians as to the needs of patients at a clinic in a low-income area of the city. Although they are skeptical of being able to bridge the gap, the librarians want to try again. However, they do not want to repeat the mistakes from past outreach efforts. In order to bridge the gap between the professionals and community members, it is crucial to know the major areas of knowledge disparity. Our group has identified 4 major areas: literacy levels, patient needs and wants, awareness, and location. Literacy can be an issue in low-income areas when people are unable to read or when their reading levels are below their age group. Technical jargon can also be a barrier for community members with lower reading levels. Patient needs and wants can also be a barrier to a successful outreach effort. It is key to know the information that your audience seeks. Providing them with information they already know will be a boring experience, as will information that is not relevant to their situation. Finding a balance between need to know and want to know is crucial. This ties in with awareness. Location is the 4th major obstacle to bridging the gap. While the entire community should be the target audience for successful community outreach, it is necessary to focus on the members of the community that were the most underserved in the last outreach effort. In this case, that would be low-income community members. Because of this, every effort should be made to provide a means of holding any events related to outreach in an area that is easy for low-income residents to access. In order to best meet the needs of the community and demonstrate the value that the library adds to the university and the community as a whole, our group proposes that the library partner with the medical and nursing departments, as well as the local municipal health department, in sponsoring a community health fair and open house. The health fair would consist of health screenings conducted by medical and nursing students and supervised by health practitioners at the health department and low-income clinic. This would allow a no-cost alternative to community members in need of vital health screenings, while also providing hands-on practical experience to the medical and nursing students. Other features of the health fair would include open panel discussions and presentations led by medical and nursing students and local health practitioners, along with brochures, flyers, and other takeaway information pieces with vital health information, and display tables for community organizations to provide information on their services. The open house would consist of a tour of the library to allow the community access to the collections. We propose that a variety of information be provided at the health fair. The more topics covered means more community members will receive the information they are looking for. Topics to be covered include the Affordable Care Act and health insurance, choosing a primary care physician, information on specific diseases and health concerns, peer experience, signing up for Medicare and Medicaid, and traditional and alternative health care practitioners within the community. All information should be written and presented in accordance with the National Institute of Health's Plain Language Initiative. Part of the NIH mission is to reach all Americans with health information they can use and to communicate in a way that helps people to easily understand research results. The Plain Language Initiative is a derivative of the Plain Writing Act of 2010. It states that the federal government must write documents such as tax returns, federal college aid applications, and Veterans Administration forms in simple, easy-to-understand language. What is plain language? It is grammatically correct and proper English written in easy-to-understand words and phrases. It avoids jargon and technical phrases. Plain language avoids any unnecessary words and phrases and seeks to communicate the message in as succinct a manner as possible. By the same token, plain language is not a dumbing down of the message or talking down to the audience. Location for the event is key. In order to not be a hardship for low-income community members, we propose that the health fair should be held in a large municipal space that is easily accessible to low-income residents. Other viable alternatives are the health department or the low-income health clinic. The open house tour will be held at the Health Sciences Library. When the health fair has ended, the library can continue outreach efforts by making health information continuously accessible to the public. Written information can and should be continuously available at the health department and low-income clinic, as well as all other local health practitioners. The library could also continue public outreach efforts through the use of text messages and a blog with RSS feeds. Text message blasts could be sent out on a regular basis with sign-up offered at the health fair, open house, and continued sign-up opportunities at the health department, low-income clinic, and other community health practitioner locations. Lastly, if the health fair proves to be a success, it could be repeated on an annual basis. The value of the health fair and open house can be measured through analyzing the return on investment as well as employing both the firm level and service level models. A return on investment analysis could be completed by looking at the services offered compared to the cost for the public to attain these services elsewhere. Low-income community members may not have home access to computers with internet access. By providing information through this program, they are saving money by not having to pay to utilize the internet through other vendors. They are also saving through not having to purchase books that they are able to use while in the Health Sciences Library. Because some of the audience may not currently have health insurance, providing access to no-cost health screenings will save them money as opposed to self-pay at the doctor's office. The firm-level model evaluation would be another method of considering the value of the health fair and open house. The librarians would need to determine how this program ties into the critical success factors and the overall mission of the library and university. The service level model would consider the value the target audience places on the services provided. This could be measured through the number of text message sign-ups, unique visits to the blog, as well as sign-ups for the RSS feed. Also, by requiring registration for anyone accessing the health screenings, it would be possible to mail a survey to participants asking for their feedback. Our initial approach was to summarize the problem and determine our target audience. Although the entire community could be said to be the audience, we determined that the low-income residents should be targeted because of the lack of success in reaching them in previous outreach attempts. No other proposals were made in determining the solution to the problem. Instead, our proposal is a combination of 3 different ideas. Michelle suggested the health fair inasmuch as providing health screenings and takeaway information. Karen proposed adding the open house and also suggested the addition of allowing outside health professionals to provide information on their services. Mark provided information on the Plain Language Initiative and recommended partnering with the Municipal Health Department. Our group concluded that combining these suggestions would have a greater impact on the target audience than any of the efforts alone. For more information on the National Institute of Health, the Plain Language Initiative, or to read the Plain Writing Act of 2010, please visit www.nih.gov/clearcommunication/plain language.